Hi, class. This week I really want to talk about speaking using the same language, and by that I don't mean English versus Spanish versus Jamaican, anything like that. What I mean is when you're on teams, when you are developing educational programs, when you are training people, it's really important to make sure that everyone understands the terms that are being used. I have some strange examples of when this didn't occur and could have caused problems. The one that sticks out most in my mind is during a graduate program, I traveled to Jamaica with some of my classmates to learn about the health system there. And surprise, when we got there, we were told that we were going to be presenting a program to students in the healthcare information program there. So I wasn't the first one to speak. Actually, I was probably about the sixth. And I noticed how often my classmates would refer to terms like Medicare and Medicaid as though they were universally understood. And we were in a country where this really isn't something that is understood. And that made me very aware that whenever I'm speaking, I have to be sure not to be using terms somebody else doesn't understand just because they're familiar to me. I used to have staff who would answer the phone at night and they would have requests for records and they would say, okay, give me the patient's SOCH. Great. What's SOCH? Well, most people that they were dealing with understood we were talking about a social security number. Would a new employee understand that? Would somebody on a team that you're working with understand when you start using terms like that? Some of the other instances I have, and they can sometimes be written forms of communication. I worked in a nursing home once where we had discharge medication lists that were given to patients on discharge, and we're talking about usually older patients. Maybe some of them didn't have anybody at home to help them. And I'd look down the list of discharge medications, and they would have terms like QD and QID and HS and AC. And I thought, well, how the heck is a patient supposed to understand what the dosage is and when to take it? It was something that we corrected by coming up with our own kind of pre-programmed discharge medication list that people would enter information into in a language that people could understand. Another instance of things that can lead to misinterpretation. I was taking a course once. I got the paper back that I had just written. I was very proud of the paper. And I looked at it, and there were nothing but green check marks all the way down the page. And I was a bit concerned because I really didn't know what this meant. Was everything that I was writing wrong? So I contacted the instructor and I said, did I really screw up this paper? And he said, oh no, that just, I keep a track of what I'm reading and whether I approve of it or not. Well, if I had a weaker heart, maybe I would have had a heart attack looking at that paper. So, when we're talking in teams and when we're talking to new employees and when we're trying to communicate, it's really important to remember terms, to remember what it was like when you didn't know everything. Have a good week.